everyone, my name's Sarah Levon and welcome back to my YouTube channel. If you are feeling pelvic pain, and I will describe the many ways that can manifest, particularly something you've heard of SPD or symphysis pubis dysfunction, pelvic girdle pain, pain on your pubic symphysis or right on your mons pubis, like where your pubic bone is, I am here for you today. So I am going to talk all about SPD or pelvic girdle pain, what causes it, and then what, most importantly, you can do to help relieve some of that discomfort in your pregnancy. But before I do that, make sure you subscribe down below. Make sure you follow me over on Instagram as well for more education and support. And then let's get going. It is totally normal throughout your pregnancy for your body to shift, get uncomfortable, and change throughout your pregnancy. Thank goodness, because that's what happens when you have a baby. Now, around week 10 to 12 of your pregnancy, the symphysis pubis begins to widen. So let's talk anatomy for a second so you can envision what this looks like. This is your pelvic bone. So this is gonna sit right here, and this is the hole that baby has to fit through. And while you're pregnant, this is also supporting all of your pelvic organs. It's keeping you safe. That bone stays in the way so that if you do bang your hip's gonna hurt, but you're not damaging your baby or you're not affecting your organs. There are two joints really in the pelvis. Now there's other joints like close to your pelvis, but I'm gonna point out two areas of cartilage that exist. One is the pubic symphysis, and that's this part right on the front of your pelvis. So what I want you to do is feel on your body. Even if you're a man, you can find you have one as well. So if you reach down, if you're a woman, kind of like on the smushy part of your vagina, or like where you think is your vagina, it's really your mons of your vulva, your mons pubis. At the top of your vagina crack, there should be like a firm surface. I know when I press on it, I'm like, it's kind of tender. If you go up a little bit, all of a sudden it gets smushy, and then you may feel like you're pressing on your bladder. You're like, ooh, now I have to pee a little bit. I know I do when I press on it. So it's down from there. There is a bone. That is this bone that you are hitting. If you have seen my Engage the Baby video, I talk specifically about how this can get in the way of the baby's head coming down. So we tilt the pelvis, we move around to help the baby navigate the pelvis. Now, when you're pregnant, we're not ready for the baby to navigate the pelvis. And what happens is this joint and then the joint in the back, the SI joint, where your sacrum is, that also is going to soften thanks to a hormone called relaxin. And that relaxin does exactly what it sounds like it does, where it relaxes the cartilage in your body, makes you a little more prone to injury, also allows for some give and some movement of the pelvis. It's released through all of your pregnancy, but one of the side effects of that softening is this pelvic girdle pain or symphysis pubis dysfunction, where it can even separate in there. And you can imagine how uncomfortable this can be. Your bones are not meant to separate, okay? We have all of these structures in there to help stabilize the body, but as a sort of normal, not anything to be alarmed about, but like very uncomfortable change in pregnancy. Some people do have pelvic girdle pain, SPD, symphysis pubis dysfunction, symphysis pubis pain, whatever. Now, what does this feel like? This feels like what we call suprapubic pain. So if you think about where your pubic area is or where you have pubic hair that grows, it's right above that or right on that area that we pressed on, where you're like, I just have this like pubic bone pain that feels so uncomfortable. It may be tender, you might be kind of swollen, you might have pain that radiates into your legs, in your hips, or your back. And why is it your back? Because of this joint back here. So that lower back pain may also contribute to this pelvic girdle pain. That's kind of like the whole girdle. You think about like if you put on like a girdle, like the goal is that the girdle holds you together, but when you have this kind of pain and in pregnancy, it's not always that way, and it can be really uncomfortable as it moves around. Now, most of the time when you have this pain, you're gonna have more pain with certain movements. A lot of times what I hear is when people are rolling over in bed or getting out of bed, and it's that turning motion where you're twisting the pelvis. You can imagine if this is unstable and kind of floppy or separated, any kind of roll to the side, and there's sort of like a movement enough in the pelvis that can be very uncomfortable. The other time is with stair walking. And why is that? Because you're sort of lifting and doing this kind of action on the pelvis. That's really uncomfortable, okay? Now, is this something to go to the emergency department for? Is this something you need to be hospitalized for? Absolutely not. This is one of those annoying, normal-ish, and it can become more uncomfortable and potentially more serious if this fully separates, but that only happens in 1% of pregnancies, okay? So it's most of the time we're dealing with uncomfortable pain that's annoying, but not a reason necessarily to go to the hospital, and also not something that's going to affect your baby or put your baby at harm. So what can you do about it? That's the most important question I'm sure got you here, all right? So depending on your symptoms and depending on the severity of your symptoms, first and foremost, I'm gonna tell you to go to your provider and say, I'm having this discomfort. Describe exactly, it radiates here, it's right here, it's this often, it's aggravated by. And then they're likely going to have you do some pretty basic things to start. And we always start with the least kind of invasive, we'll say, or the easiest options to the more challenging options, the more like intense therapies. Okay, so we're talking heat or cold. Depending on your symptoms, you may feel better if you put some heat on it. You may feel better if you ice the area. You may rotate between the two. They may suggest some massage therapy to soften things out or help with any kind of tension that's causing any more discomfort or pulling on the pelvis in any way. Physical therapy is usually the one that I go to. That's the one that I'm gonna say you need to talk to your provider, get a physical therapist, and this is really pelvic physical therapy. So, it may be a pelvic floor therapist that may be able to help you with this. It may also just be a general PT, but anybody that specializes in the perinatal period, which is like pregnancy to postpartum, the whole shebang, they can help support you with some exercises to strengthen and sort of give you some lifestyle changes to help you manage your symptoms, because that's really what we're looking at, less than fixing it. Can we fix it? Can you go through surgery to fix the issue? The answer is no, unfortunately. Most of the time, it's just let's manage your symptoms, let's get you to the birth. I'll talk about birth in a second, so that you can make it to full term and really like survive the discomfort of the SPD or the pelvic girdle pain, okay? Now, one of the other things that I usually suggest is what's called a support belt or a brace. Now, this is different than the belly bands where you have like a band that supports your belly. That's not what I'm talking about. What this is a pelvic support, pelvic girdle support. And I will link a couple options in the description box down below. They're Amazon links that you can check out, with the idea that you put a band around this area of the bone versus your belly. The belly support is more for your broad ligament. As your ligaments stretch with your growing belly, those can get stretched and feel weak, and you kind of feel like you have to hold your belly. That is different than this discomfort and requires a different type of support belt. So what it does is it sort of just holds it and stabilizes it for you. This is an easy, cost-effective, doesn't require a lot of time way to manage your symptoms. The other thing I will say is that when you're in bed, making sure to put a pillow between your legs, and then you're gonna log roll. So your legs are like this with the pillow, and as you roll over, you're not twisting your hips. You're keeping them level, so they're like this, and then you roll over like that, with the pillow keeping your legs equally spread apart, so you're not doing the bend, the twist, the whatever. The other thing is recognizing what are your symptoms, when are they aggravated, and especially, let's say for stairs, I've seen people go upstairs sideways instead of one foot in front of the other. If that helps you, then do it. And it may look kind of silly, but ultimately it really is about managing your symptoms. And then last is our medication options. So obviously we're sort of in pregnancy, we're being delicate about what medications that they'll offer. And usually providers are going to be more hesitant than maybe when you're not pregnant in giving you medications to manage your symptoms. But a Tylenol in general is considered safe for pregnancy. We're not taking ibuprofen. But obviously before you take anything, be sure to check with your providers. Make sure that they know this is going on. Because if they don't, they may have another suggestion, or they may be able to tell you something about your history that can play into it and come up with some other modalities to help you feel better. Now, one of the biggest questions that I get is, will this affect my birth? Can I still have a vaginal birth? Can I labor without an epidural? And my answer is yes. Okay, that in general, that labor provides for different sensations. In general, that movement in your pelvis is actually very helpful for your labor. Obviously, if you're totally separated, you may have a harder time coping with the pain, and that's where an epidural would maybe be a really good option for you if you're open to that. But in general, yes, you can still have a vaginal birth. It shouldn't affect your labor and birth. There may be positions I've had multiple clients that have had this sort of dysfunction where they wore their support belt during labor and there were certain squats or movements that weren't comfortable for them. And this goes back to what I say all the time across the board, is that your instinct really is the guiding point. If something feels bad, then don't do it. Now, mind you, obviously contractions, you can't tell your contraction to stop. So that's separate. But if some sort of movement or some sort of stretch or some exercise that's being recommended to you feels horrible, then don't do it. Your body is giving you those cues that are important to tune into to say, no, that doesn't feel good. We don't want, pain is an alert to not so good. Okay. So if something doesn't feel good, don't do it. Otherwise, in general, with your labor should look exactly the same. Now, once you've had your baby, the pelvis is going to normally return back to how it was pre-pregnancy by about 4 to 12 weeks postpartum. So don't expect that the moment baby's out, you're like, oh, my pelvis is totally back to normal, right? It does take some time, and that's okay. That's a part of the healing process. The pain is going to resolve in the majority of you in about 1 month after birth, and in about 80% of patients, they're going to fully recover within 6 months after delivery. So know that as much as I said 4 weeks to 12, that's the average, but it can take up to 6 weeks of delivery. Now, what I will say, if you've had full pubic symphysis separation, where this has gone totally apart, or what's considered pelvic girdle syndrome, so you've been diagnosed, that sometimes it can take longer for you. So it really is sort of common sense that the worse the problem, the more diagnosed you were, you actually are diagnosed with the pelvic girdle syndrome, that's gonna take longer to recover. It could take up to 2 years. So this is where you are working so closely with your provider, your doctor, your midwife. They're gonna likely refer you to some other specialists to help you recover, to give you some lifestyle changes, give you some exercises you can do, and help you manage the symptoms. Is it comfortable? Not at all. This stuff is so uncomfortable. It can be nagging constantly. It can really get in the way of your everyday life and doing normal things. And so that's where it's this is my alert to you that it's okay to slow down. You don't have to push through, to really listen to your body and do the things that feel better. Trying all those things. Will it totally go away? Maybe. And for some of you, it may not. And that's sort of one of those annoying flex and flow moments of pregnancy, where it's just one of those pregnancy discomforts that really will take you getting to the finish line, having your baby, and then recovering from the process of having a baby to feel totally better. Thanks everyone for being with me here today. Make sure you check out the description box for all of my fun links. There's classes down below you can click on and purchase to help you feel even more confident going into your labor and birth. I am sorry if you are struggling with this discomfort. Just know that eventually it will be better. There's hope on the horizon eventually. You just have to take it one contraction at a time. Make sure you subscribe down below, follow me on Instagram for more fun things, and then until next time, don't forget to flex and flow, and I will see you soon. Bye. Let's talk about your pelvis, my favorite organ in the body. It's not really an organ, actually. It's bone system.
Wow, I'm gonna correct you.
It's not really an organ. I really like your babies too. Those are multiple organs. Now, the pain usually resolves in the majority of patients or All right, guys.